Hello, my name is Amy Moore, and I'm in the Columbus State University MSN program. Today I'm going to be presenting my evidence-based practice Nursing 6105 research presentation to you. This research obtains to preventing hospital-acquired pressure ulcers with a pressure ulcer prevention protocol in place. For the introduction of this presentation, I would like to go over a few things with you. One being what is a pressure ulcer, the next being what is a hospital-acquired pressure ulcer, and then why is prevention important. A pressure ulcer is also known, you may have heard people call them bed sores, a pressure sore, or decubitus ulcer. And basically what a pressure ulcer is a localized injury to the skin or the underlying tissue. It's usually located over a bony prominence. It's caused from prolonged pressure or pressure in combination with shear. An example of a pressure ulcer would be lying in the bed too long, not being turned. Patients can develop pressure ulcers in that specific area, like if they're lying on their right hip for too long or if their heels are not being elevated and floated on pillows. A hospital-acquired pressure ulcer. These are pressure ulcers that when a patient comes into the hospital has no wound, that they end up acquiring a pressure ulcer within the hospital. And it's very important that we try to prevent these because Medicare and Medicaid does not reimburse hospitals for hospital-acquired pressure ulcers. It's very important because it affects the patient's health, their rehab, and their overall quality of life, and also cost. Cost that is for treatment and also cost within the hospital because they're not reimbursed. For this slide and also the next one, I would just like to show you how quickly a hospital-acquired pressure ulcer can develop. And this slide includes different stages of wounds. We're going to start with a deep tissue injury, which is also known, you may have heard it called a DTI. It's when harm from pressure is caused to the underlying tissue that the wound is not open. DTIs can open if they're not treated or if they're not found, and they usually do result in a stage 3 or 4 pressure ulcer when they do open because all of the underlying tissue is already dead and injured. A lot of people mistake these for bruises. They appear on the heels, the ankles, the buttocks, elbows, a lot of the bony areas. That's why it's very important when you're assessing the patient that you want to make sure you take their socks off and look at their heels. Floating heels and other medical devices to prevent this should be used. Deep tissue injuries can turn into a blister and then they can open up and be really deep. Like I said, because the underlying tissue is already dead. So these can develop in a patient probably within a day or so if they're not repositioned. A stage 1 is a pressure ulcer where the skin is intact but it's non-blanchable, so when you press it over the red area, it doesn't blanch. It's usually also in a localized area, such as the bony area. And as you can see in the picture, this red area, if you tried to press it to make it blanch, it would not blanch. The stage 2 to the far left is a pressure ulcer on the ankle, and it involves partial thickness, loss of the dermis. It usually has red or pink wound bed without slough present. It may have a little bit of slough, but the whole wound bed shouldn't be slough. The whole wound bed, if the whole wound bed presents with slough or jello, it's considered necrotic, which is dead tissue, and you can't stage a necrotic wound. An intact, fluid-filled, or ruptured blister is also considered a stage 2, according to the National Pressure Ulcer Advisory Panel. Here on this slide, I'm going to continue to show you how hospital-acquired pressure ulcers may look. Stage 3, stage 4, and then I'll tell you a little bit about prevention. For the stage 3s, These pressure ulcers are considered full thickness tissue loss, and this is where the wound bed is already into the subcutaneous fat. So it may be visible, but bone, tendon, and muscles are not exposed. Fluff may be mixed in the wound bed, so the whole wound bed may not actually be pink or red. A lot of slough should not be in the wound bed. If the whole wound bed is covered with yellow slough, then that's considered non-necrotic, like I mentioned earlier, and you wouldn't be able to get a depth. So these wound beds may have a little slough mixed in it, but you should still be able to get a depth. The overall wound bed should be pink or red, and that's your stage 3. For stage 4s, this is the worst kind of pressure ulcer that you can get. This is considered a full thickness tissue loss. It usually has exposed tendon, muscle, or bone. Slough may also be mixed in this wound bed, but the whole wound bed shouldn't be slough. And as far as prevention, pressure ulcer prevention, we all know this is very important, especially when a patient comes in with no wound and then they're in the ICU or they're in the hospital for a long, extended amount of time. We really need to make sure that these patients, if they're immobile or if they have any kind of disability, we need to make sure that these patients are getting turned and repositioned and just help them keep these patients mobile so they don't acquire a hospital-acquired pressure ulcer. It's also important if a patient does come in with a pressure ulcer that's present on admission that we know how to correctly stage them. That way the hospital is not held accountable for the pressure ulcer if it was present on admission. Research throughout this project has shown evidence that a PUP protocol with other interventions that involve prevention can be very effective in preventing and reducing hospital-acquired pressure ulcers. Here I'm going to be discussing the overview of the problem. In all patients that are at risk for developing a hospital-acquired pressure ulcer, also known as HAPU, how does having a pressure ulcer prevention protocol in place compare to not having a PUP program in place in healthcare facilities? And does the PUP protocol methods make a difference? I just wanted to go ahead and let you know what the problem was and the name of my PICO question that I am researching. Hospital-acquired pressure ulcers are associated with increased length of hospitalization, as I mentioned before, rising healthcare costs, and higher morbidity rates. Hospital-acquired pressure ulcers also cause a burden on families and the patients, and also the hospital that it occurs within, or if it's a different kind of facility such as the LTAC or rehab. It just causes a burden overall for the patient and families, the staff, and the hospital. In the United States, pressure ulcer treatment is estimated to cost on an average of approximately $11 million annually. That's a whopping amount of money. The average cost to treat a single stage 4 hospital-acquired pressure ulcer alone has been reported to range from anywhere from $75,000 to $120,000 annually. So as you can see, that's a lot of money to treat a wound, depending on how severe it is. These wounds can cause the patient to have prolonged stays in the hospital. It can lead to other infections. It can even lead to sepsis. Any patient that is immobile and needs assistance with mobility is at high risk for developing pressure ulcers. It's only logical that activity and mobility are the highest predictors and highest priorities of risk, as it is seen that these factors cause patients to be at a higher risk for exposure to pressure and shear, which both result in pressure ulcer formation. So we really need to be aware of these patients' needs. With the use of a PUP protocol within healthcare organizations and facilities that is used by all healthcare providers within the facility, the rate of hospital-acquired pressure ulcers can be decreased and they can be prevented. So not only does one unit in the hospital need to be participating in a PUP protocol, but it needs to be done across the board within the whole facility. Everyone should be taught on the proper way to do it, what the PUP protocol includes and exactly what guidelines they're using. Here this shows exactly what my PICO question was. Once again, in all patients at risk for developing a hospital-acquired pressure ulcer, how does having a pressure ulcer prevention protocol in place compare to not having a pressure ulcer prevention protocol in place in healthcare facilities, and does the PUP protocol methods make a difference? This PICO question is considered to be interventional because it does focus on prevention, focusing on the overall prevention of hospital-acquired pressure ulcers within healthcare facilities. The theory conceptual model that I chose for this research project is Betty Newman's system model. When I was doing my research, I became very fond of Betty Newman's system model because with this framework, it can be used with this research project, and this type of framework, the patient is looked at from a holistic perspective, and I think that's very important. The individual or the patient is looked at as a whole, with the use of this type of framework is used in research, not just as an illness or an injury that must be treated. With Betty Newman's nursing theory, the patients are always cared for from a holistic perspective. This is in order to ensure that they're cared for as they should be, like a human being, like a person should be, not just an ailment. Newman's system model was first designed in 1970. This model was first developed as a graduate course guide, and then in 1972, the May-June edition of Nursing Research published a model for teaching the total person approach to patient problems, and this became the Betty Newman Systems Model. This model coincides with my PICO question, and it looks at it in a holistic manner as far as how a PUP protocol can benefit the patient from the beginning of their care in the hospital to the end. The literature review for this project included 6 articles, and these 6 articles I reviewed, and they were done for this research project. Basically, all 6 articles did show evidence that with the use of implementing a PUP protocol in healthcare facilities, hospital-acquired pressure ulcers can in fact be decreased and then even prevented altogether. So with that being said, basically this will decrease costs, overall quality of patient care, and so many other things. The articles that were obtained for this literature review were articles of research that took place at various healthcare settings, including acute care, long-term care, rehab settings, and other inpatient settings. Participants of all ages were included throughout the reviews. With the implementation of a PUP protocol, it is shown to be positively correlate in reducing or preventing HAP use. Evidence-based practice has shown that there is an urgent need for the design, implementation, and evaluation of such interventions to prevent pressure ulcers in a variety of settings. As with anyone doing a research project, there is ethical considerations that should be taken into consideration. 2 ethical issues that I come upon that may be taken into consideration with this research topic include benefit and harm and consent. These 2 ethical considerations could have the potential to impact this research project as many as other research projects. Researchers should always take into consideration to keep up to date with the most current ethical guidelines for the protection of human beings required by the federal law, funding agencies, and other local institutions. Benefits must always outweigh the risks of harm when it comes to research. Consent is another ethical issue that should always be taken into consideration. Informed consent is a process that must often be revisited as the subjects do engage in the research and to make sure that they understand the expectations and implications more fully. As with any research project, it's always important to be aware of all the ethical issues that can be involved and to take them into consideration. As with any research project, you always want to look at possible grant sources and sources that can help you for funding your project. So the agency that I would reach out to for possibly funding this research project would be the National Pressure Ulcer Advisory Panel. A little bit about them. The National Pressure Ulcer Advisory Panel serves as an authoritative voice for improved patient outcomes in pressure ulcer prevention and treatment through public policy, education, and research. The National Pressure Ulcer Advisory Panel is an independent, nonprofit, professional organization that's dedicated to the prevention and to the management of pressure ulcers. This particular National Pressure Ulcer Advisory Panel was formed in 1986, and the NPUAP Board of Directors is composed of leading experts from different healthcare disciplines. All of these experts whom share a commitment to the prevention and to the management of pressure ulcers. I think that this agency would be an ideal agency to use for projects such as this. The National Pressure Ulcer Advisory Panel does participate in grant writing for research projects of this, so that's why I would want to reach out to this particular one for grant sources for funding this project. Basically, I just want to do an overview, summary, and conclusion with you about everything that we've been over so far in the presentation. As you can see, pressure ulcers are a problem nationwide, and with the intervention of a PUP protocol, it has been shown to be effective after researching this topic. Addressing this issue within healthcare organizations is very important to reduce and prevent hospital-acquired pressure ulcers. Evidence-based practice has been shown that there is an urgent need for the design, implementation, and for the evaluation of interventions to prevent pressure ulcers in a variety of different healthcare settings. So with that statement in mind, it makes me think that a PUP protocol should be implemented into every healthcare facility if there's not already one implemented. This is one reason that I wanted to do this research project, because the organization that I work with right now currently does not have an actual PUP protocol in place, and we're really working hard to get a PUP protocol implemented into the organization across every unit in the hospital. In conclusion, the nursing profession demands that patient care be safe and effective. Incorporating knowledge of nursing theory with nationally accepted standards for patient care, data from personal or collective research, recognizing socio-cultural values, and our commitment to lifelong learning is necessary to address the challenges that we face as a nation. So please just keep in mind that this is a very important research topic to me. And with all the research that I've done, it has been shown effective. So now I want to proceed in my facility and help them to know that we do actually need this pressure ulcer prevention protocol that we've been speaking of now for about a year or so. This here includes one of two slides that shows all my references that I used. So if you're interested in anything like a PUP protocol within your facility, or if you want more information, these references could be great to use. The next slide also has more references. This includes the second of one slide for references. So this is the remainder of the references if you're interested in looking at any of them. Please always remember that pressure ulcer prevention is very important in the healthcare field. I want to thank you for watching my presentation, and I hope you thoroughly enjoyed it. Thanks, and have a great day.